Welcome! My name is Misty Alt-Anderson, and I work in OHRP's Division of Education and Development. This tutorial was created to help explain some of the requirements relating to IRB membership. It reviews the requirements for IRB membership set out in the HHS Regulations for the Protection of Human Subjects at 45 CFR Part 46 and answers some common questions. After completing this tutorial, you should have a better understanding of the regulations regarding IRB membership and how to apply them. Let's get started. An Institutional Review Board, or IRB, is a committee that monitors and protects the rights and welfare of human subjects in research. IRB review is a core component of human subjects protections under the HHS regulations. The IRB determines whether the reviewed research activities meet regulatory requirements and standards prior to and throughout the course of the research. The weight of this responsibility means that the selection of members to serve on the IRB should be thoughtfully considered, with a particular emphasis on their experiences and perspectives. The regulations require each IRB to have at least 5 members with varying backgrounds. The IRB must be sufficiently qualified through the experience, expertise, and diversity of its members to review the institution's research activities. Relevant considerations include training and education, race, gender, cultural background, and sensitivity to community attitudes. In addition to a diversity of experience and perspectives, the IRB as a whole must be able to review proposed research in terms of institutional commitments and regulations, applicable laws, and standards of professional conduct and practice. This means that its membership must include people who are knowledgeable in these areas. An IRB needs to possess the professional competence to determine the acceptability of proposed research with respect to regulations and policies, which includes whether the design and methodology of the proposed research is ethically appropriate. It is expected that the IRB will have the appropriate expertise to meet the membership requirements with respect to the type of research it regularly reviews. For example, an IRB that routinely reviews psychology research would be expected to include 1 or more members with an expertise in that area. Similarly, if an IRB regularly reviews research involving vulnerable populations, it should have 1 or more members who have knowledge of and experience working with those populations. To help ensure the IRB has the necessary expertise and diversity, the regulations put forth some minimum membership requirements. As noted earlier, there must be at least 5 members. Of these, each IRB must include at least 1 scientist, at least 1 non-scientist, and at least 1 member who is not otherwise affiliated with the institution. Institutions must indicate in the membership list whether members are scientists or non-scientists, and whether or not they are affiliated with the institution. In addition to the other categories of members, if an IRB oversees a study involving prisoners, as defined under Subpart C, at least 1 member of the IRB must be a prisoner or a prisoner representative with the appropriate background and experience to serve in that capacity. OHRP recommends that a prisoner representative have a close working knowledge, understanding, and appreciation of prison conditions from a prisoner's perspective. If a particular proposal is reviewed by multiple IRBs, which may occur for a cooperative research project, only one of the reviewing IRBs needs to satisfy this requirement. Note that when reviewing research involving prisoners, a majority of the IRB members, excluding the prisoner member, must not be associated with the prison involved outside of their membership on the IRB. Each IRB must have at least 1 designated scientist member. This member's primary concerns are in scientific areas. This means at least 1 member must be able to review research activities from a scientific perspective. This member should be able to provide meaningful insight about the science, such as the scientific validity of the hypothesis or proposed methodology. When considering whether an individual fulfills this requirement, think about whether their professional training, background, and occupation equip them to review research activities from the standpoint of a scientist working in the biomedical or socio-behavioral disciplines. If so, that person might be a good choice to fulfill this requirement. Linda studied philosophy in college and later earned a master's degree in public health. She currently conducts epidemiological studies on infectious diseases with major public health implications at a state university. Is she qualified to serve as the scientist member on her university's IRB? Likely, yes. Regardless of Linda's undergraduate degree in the humanities, her postgraduate training in public health and her experience in conducting research in infectious diseases would likely qualify her to serve as the scientist member on the IRB. Each IRB must also have at least one designated non-scientist member. This member must be a person whose primary concerns are in non-scientific areas. Their professional training, background, and occupation should indicate that they are likely to review research from a perspective outside the realm of biomedical or socio-behavioral science. This requirement helps ensure that there will be discussion of diverse perspectives and consideration of a broad range of issues that may affect research subjects. Peter has a PhD in social work and was trained in the scientific method for his dissertation. However, for the past 10 years, Peter has worked to secure access to public benefits for underserved immigrant communities. The IRB chair wants to recruit him as a non-scientist member. Is Peter eligible for the role? Likely, yes. Even though Peter has received training in the scientific methodology, his professional experience includes no direct involvement in any scientific work. It's reasonable to assume that Peter will be inclined to view research from a standpoint outside of any scientific discipline. Thus, he is likely eligible to serve as a non-scientist member of the IRB. Each IRB must also have at least one designated unaffiliated member. The unaffiliated member must not be affiliated with the institution aside from serving on the IRB. This member also must not be someone who is an immediate family member of a person affiliated with the institution. OHRP considers spouses, parents, and children to be immediate family members. Anyone who is affiliated or is an immediate family member of an affiliated person cannot serve in this role. For example, part-time or full-time employees, current students, members of any governing panel or board of the institution, paid or unpaid consultants, healthcare providers holding credentials to practice at the institution, and volunteers working at the institution on business unrelated to the IRB, are all considered affiliated, and as such, they or their immediate family members cannot fulfill the unaffiliated member requirement. Some limited institutional associations still permit persons to serve as an unaffiliated IRB member. Examples include past or current patients of the institution, past or current subjects in research conducted by the institution, former students of the institution, infrequent or small donors to the institution, or former or retired employees not receiving benefits from the institution, such as pension, housing, or health care. Such individuals could serve as the unaffiliated members of the IRB. Note that paying unaffiliated members for their IRB service does not make them affiliated. Although the unaffiliated member is often referred to as the community member or community representative, the regulations call for an unaffiliated member and don't specify that this member represents any particular community. The regulations require an individual who is not otherwise affiliated with the institution. For example, a hospital chaplain may be an active and vocal community advocate, but if she is employed by the hospital, she cannot be the unaffiliated member on the hospital's IRB, nor could an immediate family member such as her spouse. However, she could serve as a non-scientist member. Note that the regulations allow for a member to fulfill more than one role. For example, one person could serve as both the unaffiliated member and the non-scientist member. Dr. Jones worked as a pediatrician at your research medical center for 3 years prior to her retirement. She does not currently maintain any ties with the institution. As the IRB chair, you would like to recruit her to serve as the unaffiliated member, or what many refer to as the community member, of your IRB. Is Dr. Jones eligible for this role? Likely, yes. Dr. Jones is eligible to be considered as an unaffiliated member of your institution's IRB if she is not receiving any benefits from the institution, such as retirement, pension, or health care benefits, and does not have any other affiliation with the institution. An IRB administrator who meets the membership requirements may also serve as a member, provided the administrator is included on the IRB membership list, as required for IRB members in general. Note that an IRB chair is necessarily a member of the IRB. If an IRB regularly reviews research involving populations vulnerable to coercion or undue influence, such as children, prisoners, individuals with impaired decision-making capacity, or economically or educationally disadvantaged people, consideration must be given to including as an IRB member one or more individuals who are knowledgeable about and experienced in working with these populations. An IRB may decide that reviewing a particular research proposal or a set of activities requires a specific area of expertise not provided by its membership. When this occurs, it may invite individuals with the necessary competence to supplement the IRB's experience and assist with review. For example, someone with a particular expertise in epidemiology or pediatric oncology might be needed to review a specific clinical protocol, or an individual who has experience with and an understanding of a particular community's norms may be asked to provide input on a study's recruitment strategy. Outside experts don't need to be present for all aspects of discussion, and their participation can take various forms, such as in-person attendance, or teleconference with a convened meeting, or providing written or oral advice in advance of the meeting. However, participation of non-member experts in a convened meeting must be documented in the minutes. It is important to remember that non-member experts may not vote with the IRB. IRBs may designate alternates for some or all of their primary members to ensure that full board meetings can be convened, even if one or more of the primary members are unavailable or lack the necessary expertise. Although how an institution selects and identifies alternate members is left to the institution's discretion, the requirements regarding the number and type of members that must be present at a meeting must still be met. For example, if no designated non-scientist member can attend a meeting, the alternate who attends must also be a non-scientist. The HHS regulations do not address term limits or length of service for IRB members or chairpersons. It is up to the institution or the organization operating the IRB as to whether and how it develops policies regarding length of service, the staggering of term limits, or balancing continuity of experience with the inclusion of new perspectives and expertise. That concludes this review of the IRB membership requirements. We hope you found it helpful. We've focused on the key ideas here, but encourage you to consult the regulations for more detailed information. Visit OHRP's website, www.hhs.gov/OHRP for additional information. Thank you.